with a critical blood sugar value of 1000. I paused for a few seconds and without further questioning, I told her to give the patient 10 units of IV regular insulin. I didn't feel any urgency to go and see the patient as if this was enough to solve the problem. I finished morning report, then I went to check on the patient. Guess what had happened? I found that 10 units of insulin were not given. Luckily, one of my attending physicians was there and he questions the unusual very high value of blood sugar. He asked them to repeat blood sugar using a peripheral stick, and guess what was the result? It was only 150, not 1000. So what happened here? Apparently, this blood sugar value was obtained from a sample drawn from the PIC line where ATPN, total parenteral nutrition, was running. Of course, the blood sugar concentration there was very high because of that. Luckily, this was a harmless mistake and a great lesson for me. I want you to avoid such mistakes. Know how to ask further follow-up questions. Know if you need to go and see the patient right away or not. And of course, provide a proper management. You all know our great nurses are the cornerstone of our patients' care. They spend way more time with them. Usually they are the first ones to whom patients express any complaint, concern, or to whom any critical lab or imaging results will be reported. The next thing, of course, a phone call from our nurses to relay that to us. The goal of this course is to make you very comfortable responding to all sorts of phone calls you will be receiving from our nurses while taking care of our wards patients. Responding appropriately and efficiently to such phone calls will help you create a good impression to everyone working with you, and more importantly, helps you provide a great patient care. I will teach you how to respond to the phone call itself, how to ask the right follow-up questions to help you give the right management decisions. But first, I want to take a minute here to emphasize how important our nurses to our patients' care. We form a team. We work together. It's very important to have an excellent relationship with them, and our next video actually in this course will be about that. Keep your nurses informed about our patients' care. Be kind and responsive to them. Take it from me. Keep your nurses happy and make them your friends. This will make your life a whole lot easier and of course improve our patient care. As I said, next video I will go in much more details on how to build a great relationship with our nurses. Now, what kind of things our nurses may call us for? They may call us for one of the following: a patient's symptoms, an abnormal patient signs including abnormal vital signs or abnormal telemetry findings, a patient's request like a patient may want to shower or change his diet or wants to leave, critical lab findings like positive blood cultures, for example, critical imaging results like a positive lower extremity venous Dopplers for DVT. They will call us to tell us about that results. They may call us relaying a family request or concern, or they may call us simply to give us an update on our patient status. And finally, they may work as the middle person between different providers or departments. You may wonder here, why don't we talk to each other directly? Yes, that would be much easier, faster, and ideal, but in reality, still, a lot of providers or departments call the nurse for the nurse to call us and then get back to them, like anesthesiologists call the nurse to call us asking about a preoperative clearance, or a radiology department asking for a clarification regarding a study. Of course, my advice to you is to pick up the phone and call them directly to save yourself and your nurse time and effort. Responding to nurses' phone calls means responding to a wide range of clinical and non-clinical problems we may encounter with our patients. These include, but not limited to, responding to emergencies, responding to a wide range of patient symptoms including chest pain, shortness of breath, headache, fever, agitation, abdominal pain, nausea, vomiting, just name it. Responding to a wide range of clinical signs like abnormal vital signs like hypertension, hypotension, tachycardia, bradycardia, fever, etc. Responding to a wide range of abnormal lab findings including electrolyte disturbances, hyperglycemia, hypoglycemia, positive blood cultures, etc. Inpatient pain management and how to tell if there is any drug-seeking behavior. Diet and NPA orders. How to assess patient falls. How to pronounce dead patients. and of course a wide range of non-clinical problems like leaving against medical advice, refusing medication or a test, how to deal with angry patients, patients who eloped, patients requesting a smoking break, etc. Now, every time we receive a phone call from one of our nurses, make sure to get the following information. First, who is calling? The name of the nurse. Second, who is the patient they are calling for? Get the name and location of that patient. Make sure it is someone you are covering to avoid giving orders to a patient you are not taking care of. And if you are in doubt, just check your list. Third, what exactly they are calling for. Here, be straight and specific, as follow-up questions will depend on this. For example, a nurse may call you saying, "Can I have something for my patient's pain?" As you see, the request here is vague. So before giving any orders, ask what kind of pain. Is it chest pain, back pain, or incisional pain? This drastically affects our management, as you could see. Fourth, ask any necessary questions relevant to the specific complaint. Like in the previous example, let's assume it was a post-operative incisional pain. I would ask about the exact location of the pain, its severity, what painkillers have been tried so far, what doses, did they work, is it associated with other symptoms like fever or vomiting, are vital signs stable? This may seem a lot of questions, but this should not take more than 1 to 2 minutes to get all this information. Finally, get the habit of always asking about the current vital signs, including pulse oximetry. Don't forget about it. If there is no current set of vital signs, kindly ask them to perform one and call you back, unless it's an emergency. In such case, just go immediately and try to save the patient life. Now, of course, you don't have to ask for vital signs every time they call us for something. But if they are calling about one of the following signs or symptoms, please make sure to get the full set of vital signs, as this will affect the way we handle the case. If they are calling to report any single abnormal vital sign, for example, if the patient pulse oximetry is dropping or if the patient is febrile, get the rest of the vital signs. Ask them to perform all the vital signs. If the patient is complaining of chest pain, get the full set of vital signs. Same for shortness of breath. Same for abdominal pain. Same for flank pain. Same for back pain. Same for vomiting, hematemesis, melena, or rectal bleed. Also get the full set of vital signs if the patient is complaining of headaches. Also, if there is any abnormal telemetry events. Also, if there is any critical labs reported to us, like critical anemia or positive troponins. And of course, whenever in doubt, please get the full set of vital signs. Now we have the patient name, location. We made sure he is a patient we are taking care of. We know why they called us for. We asked the right follow-up questions. We got the patient vital signs. Now we should be able to decide how urgent or emergent the situation is. Please leave everything and go and see the patient right away, immediately, if the patient is unstable. And unstable patients means any patient with unstable vital signs, decreased level of consciousness, low GCS. If there is any symptoms associated with abnormal vital signs, even if it is a single abnormal vital signs, for example, headache with very high blood pressure, or abdominal pain associated with hypotension. This is an emergency. Go and see them right away. Hypoxia. Usually the nurses call us reporting dropping pulse oximetry. Whether this was symptomatic or not, even if all other vital signs are stable, hypoxia is always considered an emergency that needs to be corrected and taken care of as soon as possible. And we'll come to that later in this course. Any symptomatic telemetry events, for example, an episode of frequent PVCs and dizziness, go and see them right away. Or persistent telemetry changes even if asymptomatic, like persistent white complex tachycardia or atrial fibrillation with rapid ventricular response. Also go and see them right away. Any syncope or falls in hospitalized patient, go and see them and assist them right away. Also, if rectal bleeding, melena or hematemesis reported, go and assist them right away. Also, if the patient's nurse relate to us any concerning new physical exam findings, for example, they may call us saying the abdomen is distended or rigid, or there is a new neurological deficits, or there is a new big ecchymotic area in the flank area, go immediately and assess them. Also, if there is critical electrolyte derangements, even if asymptomatic, do the same for any level of electrolyte derangements. if associated with any symptoms or sign, like hyponatremia and confusion, or hyperkalemia with changes on telemetry. Go and see them and assess them right away. And of course, if any doubt, you're just not feeling comfortable about the patient, just go and see the patient. Now, on the other hand, if the patient is hemodynamically stable, this means we have sometimes to finish what's in our hands. We can give some orders over the phone if necessary, of course, finish our meals or finish seeing a patient or go to the bathroom, then go and see the patient or decide if this can be completely managed over the phone. Patients with the following symptoms or signs who are hemodynamically stable, very important, hemodynamically stable, should be seen within 10 to 20 minutes on average. Patients with fever, shortness of breath, chest pain, abdominal or flank pain, back pain, brief and asymptomatic events on telemetry, for example, few seconds or beats of asymptomatic wide complex tachycardia, or a brief 2-second sinus pause, and low urine output, and some other conditions, as long as the patient remained hemodynamically stable. How about things that can be managed completely over the phone? Yes, some requests, complaints, or concerns can be managed completely over the phone, again, as long as these symptoms were isolated and the patient remained hemodynamically stable. Examples of such cases are insomnia, anxiety, isolated constipation, I mean here without pain, without abdominal pain, without vomiting, simple electrolyte replacements like repleting hypokalemia or hypomagnesemia, simple order clarification, diet orders, giving okay to shower orders, PT order, physical therapy, getting out of bed orders, and things you feel with experience comfortable managing over the phone. Let's finish by giving you some real-life examples. In these examples, I want you to decide if we should go and see the patient, and if yes, how soon should we see the patient? Emergently, within 10-20 minutes, or is it something that can be managed over the phone? A nurse called regarding a patient who is having chest pain. Vital signs are stable, no other associated symptoms. You order a stat EKG and troponins over the phone. Do you need to go and see the patients? And if yes, how soon? In this case, of course, I need to go and see the patient. But the patient is hemodynamically stable, EKG and troponins ordered over the phone. So in such case, I will plan to go and check on the patient in about 15 minutes. This will allow the patient's nurse to have the EKG done. And if in your hospitals you are the one responsible for doing the EKGs, then you should go and do it immediately. A nurse called regarding a patient with chest pain and shortness of breath. His pulse oximetry reading 84%. Do you need to go and see the patient? And if yes, how soon? The patient here is clearly unstable. Over the phone, I will immediately ask the nurse to pump up the oxygen to the maximum. Then I will immediately go and see the patient. I will leave everything and go and assess the patient. This is an emergency. A nurse called regarding a patient requesting a sleeping pill. Do you need to go and see the patient, and if yes, how soon? Clearly here we are dealing with an isolated and simple request that can be managed completely over the phone. A nurse called regarding a patient who wants to leave against medical advice. Do you need to go and see the patient in such case? And if yes, how soon? Here it is much better to go and see the patient to understand why the patient wants to leave AMA against medical advice and see if we can solve the issue. Of course, there is no emergency here. Finish what's in your hand, then go and see the patient and try to figure out what's going on. Let's stop here. Next video, I will talk about how to build a great relationship with our nurses to make them our friends, not our enemies. Please make sure to give this video a like and share it with your colleagues if you find it useful, and I'll see you next video. Thanks for watching.